So today we are going to have a great conversation with Christine Nolan from Trinity Village.
Love Christine. Tons of good energy.
Worked with her a lot. It's a great program that she has. I'm curious. I know I've heard the buzz about some expansion, so it's going to be pretty cool to see where they are with that.
Yeah. I love their program that they allow parents to be in their sober living with their kids.
Mhm.
I think that's a great program.
It's going to be good.
Yeah.
It's going to be good. I know they just moved from in Portsmouth. I believe they're now in Middletown. So, she tried to explain to me where they were, and for the life of me, I couldn't picture it. So
We'll ask her.
hopefully today we'll get a little more explanation as to exactly where it is. But it's going to be a great one. I'm going to be very excited to hear, all the other programs, all the services that they do provide for the recovery world. So without further ado, so today with us on Totally Preventable, we have the founder and CEO of Trinity Village, Christine Nolan. How are you, Christine?
Good, Greg. Good. Hi, Pauline. How are you? Thank you for having me on your show this morning.
It's great to have you.
Our pleasure.
On Totally Preventable. It's wonderful to be here.
It is great to have you here. It's great to have you. I'd really like to jump right into it. Can you tell our listeners a little bit about yourself?
Sure. So I have been living in Newport County now for about 17 years. I have 4 beautiful children that have been raised here and had been blessed with their education through our public school system, as well as been able to do some community work with our partners here in the recovery community with behavioral health. I started and this is a piece I started many years ago looking at, what can I do to get involved in the community? And when I came here, moved to here with my husband at the time, he was involved. He was an officer in the Navy. We really were blessed with retiring here. So when we got settled in, a lot of things that I did is I got involved in the schools. I got involved in my church, and I really sprung out to get to know a lot of our neighbors, the beautiful networks that are here to support and really be an active player in the community to help develop some of the things that people need as far as services are concerned. I always like to talk a little bit about my personal journey and my personal story as a person in recovery. So I'll go right into that. Once we got settled here, again, I had 4 beautiful children. They were very young. And, I had started at a very young age enjoying some recreational drinking and embraced my college years where, to what I want to say today, it looked like a little bit of the norm of how people drank and use drugs. That's a part of my journey as far as my personal struggles that I'll talk a little bit about. And so I apologize for the music in the back. Anyways, so really what happened at that point was that I came here with my children and getting very involved in the community. And I realized that after having my 4th child, that certain stresses in my life started to affect me a little bit more. I struggled with, keeping the day-to-day routines of the commitments around the children, really looking at, trying to take care of myself, that self-care, and really focusing on the family unit, my family, doing what was important. And as the kids got older, I had some troubles within my marriage. And so different stressors came into my life that I really found a little bit overwhelming, and it drew a lot of anxiety, and I started to feel extremely depressed, especially after my 4th child. So, as the days are busy with young ones and as they're getting older, and for your listeners, and I know there are many women out there and gentlemen out there, parents out there that have struggled with, at the end of the day, you like your glass of wine or a beer or something of that nature that kind of, gives you what you think makes you feel more relaxed. Then you're out with your friends and you're socializing. So my drinking started to get a little bit more progressive, where I was looking to go out a little bit more just to relax and enjoy myself through a drink, and as well as, at night, if the kids were all settled in, I would sit down and I would also enjoy what I thought was, my cocktail at night to just kind of relax. Well, it wasn't too long, and there is a study on this about women, is the progression of that use of alcohol and medications at the time got pretty progressive in about 18 months to 2 years, where I went from, drinking a few glasses of wine and having some depression, antidepressant medications and anti-anxiety medications. Mixing that with alcohol did not serve myself well. It actually had a reverse effect on it, where my anxiety increased and I felt more severely depressed. And it was a struggle within myself that I didn't realize was very detrimental to my well-being, meaning that I started to lose weight. I couldn't sleep. I had difficulties with eating, and as far as wanting to eat, not wanting desire to eat. So there was a lot of ripple effects around the increase of my intake with alcohol and drinking to how I was physically feeling, and then emotionally. I was starting to really feel the effects of that. So but again, not focusing on the fact that I thought it was, oh, I'm drinking too much, or I'm drinking too frequently, and all of that, and the hangover. And I use the word hangovers, but the symptoms of withdrawals after you have a long night of drinking, which a lot of people know, whether it's tremors, whether it's cravings, and all of that. So the progression and the symptoms of alcoholism, the disease of alcoholism, got pretty progressive with me, and I did have those tremors, and I did have those increased cravings, and I really had some. I was looking for that next glass, where that next glass of wine comes. It's almost, I mean, if you talk to people in recovery, we all go through very similar experiences with the struggles of this that we identify with. And so the progression was there. And there really, my tolerance had changed. So my intake would change, and the effects of my behavior would change around that. I would experience a level of intoxication a lot quicker than I would, or I was acting out unsafely for myself and my family, and these were all things that were right here in my face. But the being actively in the disease and embracing any path of recovery kept me in this cycle of doing the same thing over and over again. And I'd get up in the morning saying, what am I going to do differently? I mean, I'd be up at 5 a.m. going for a run, thinking that's going to stop, help me with the withdrawals, and I'm going to feel better. And I'm not an alcoholic, but I knew in the back of my head I had a problem. I knew I couldn't just stop. Although there was family members that thought, well, why can't you just put it down and stop drinking? It was like this had taken over. I said, as much as I want to say, I get up every morning, I'm not going to have that glass of wine today. I'm not going to have that pill today. I'm not going to do what I did yesterday that caused me a lot of guilt and disgust, I mean, because it puts you in that place when you realize that after you have ingested this chemical, you're acting out in ways that are not of you, right? You're saying things that are not of you. You're fighting with your spouses, or it's just it's like that Dr. Jekyll and Mr. Hyde. You get too much and anybody, and your behaviors and your attitudes change, and you really start hurting yourself and the ones you love. And so I came into it where I had a situation where it got so progressive that I was struggling with the tremors, and I really I just I was done. I couldn't live with it, and I couldn't live without it, and I didn't know how to even embrace it. And to the family that loved me the most, they didn't know how to help me. And I had 4 little ones that I really needed to make sure that they were safe and taken care of. And so I needed to embrace and help. So I put myself in treatment over time, and I came back into my community. And the first thing that they did, the recovery community, was embrace me, saying, come on, let me help you, show you the way. There was a lot of paths there that I could really fit into what I thought was going to help support me where I was at with my co-occurring. I had still struggling with mental health disorders like depression and anxiety, highly. I had some PTSD. I had some physical things that had affected me, which happens with alcoholism and drug use, any form of addiction. I had some physical things I had to, health-wise, I had to address. So I was all in. I'm like, whatever you think is going to work, that's evidence-based, I'm willing to do that. And that's what I embraced. And I didn't look back. I continued to put like-minded people around me that were in recovery. I started embracing other opportunities to continue what I call continuum care, continue my treatment. I had embraced a 30-day inpatient residential. I wanted to continue that back in my daily life for a period of time that I thought that under the guidance of professionals, I'd be able to continue to get therapy, group sessions, and my medications monitored. And so all of this was a personal experience. And in that story, while I was doing that, embracing my recovery, I realized that I had to also look at my environment, that stress I was talking about really had a great impact on, early stages of recovery. What was I doing to build a foundation that was going to help me start living healthy? Because I had to start making some healthy choices. And one of the things, and any mom out there or father that has children that, you know, you're very nurturing, you're a caretaker, and your children depend on you, is you really have to make some healthy choices for yourself, your own self-care, so that you can be all you can to your children and to your relationships, your partner, and all of that. So for me, what was beneficial, where my stresses were really escalated at home, and again, some of the things that were changing in my marriage, things that were, taking care of my children, I went into a sober house, and I really embraced putting an environment around me that was conducive for me to strengthen my recovery. And that was very personal. That was a personal choice I made, but very well served, because everything around me was conducive to my recovery. It continued to lay the foundation that I need for long-term care, for long-term recovery, but more so for totally to prevent relapse, right? I needed to embrace a path where I had tools, I had some education, but I had some tools that would help me deal with the symptoms of the disease of addiction, because I misused medications as well. Um, and be able to give me a quality of life. I needed to be able to live life on life's terms. And how do I do that? I need the right coping skills. To me, I was open to anything. So I embraced some holistic alternatives, which were, I'll talk a little bit in our model. And I really educated myself on prevention. I shared that with other people. I started working with others in the community that were struggling as well. And I got involved in service work, which was a real big part of the whole embrace of long-term prevention, as well as sustaining my own recovery. So with that, in my own story, and please stop me if you have any questions about it, is that I looked at what worked for me, and I said, how do I give this back? How do I show and really build a model within my beautiful community here, which is just amazing. Our partners, our collaborative partners we work with, the community members themselves, our senators and all that. How do I invest where I can bring my story, because it's powerful, to others, and give them the resources they need to maybe embrace a path that works for them with these resources in the community, working with my community partners, and integrate a program that is all paths for any family member, both family and the member that's struggling, that can come into a place and say, what's the next step? How do I get help? And the model is we focus on 3 pillars, and it's all part of what I just shared. We look on access to treatment, okay, for that, to embrace prevention, to sustain the path that they're on, introduce a new path. We have intense outpatient program. We have a behavioral health clinic that deals with substance use disorders as a primary, and anybody else that's struggling with some mental health conditions like depression, anxiety, PTSD. We do a lot of work with that. We have, I'll talk a little bit about healthy living at the end of this. We opened some beautiful recovery residences here on the island for women and children, and for med. And we even had a co-ed model working for a period of time that was excellent. And then we work with labor and employment. We have 14 now, after COVID, 14 community partners that help bridge any member that comes into to either one of those entities, that they can embrace some opportunities about how we help them get financial security. We work with our community banks to do education, financial education. We do work with some community retail stores and other venues here in the community that are willing to create opportunities for people that come through Trinity for employment security, financial security. So that was the kind of the things that happened in my personal story. And I didn't get too much into the financial piece of it for me, because anybody that experiences addiction or struggles with alcoholism knows that it has a great impact on your finances. And whether it's the cost of treatment, whether it's the cost of using and drinking when you're actively in your addictions, everybody comes from a place that might need that assistance. So we do offer a lot of financial support and venue and bridges to that gap. So that's really how that 3-pillar model come in, was access to treatment at our Trinity Healthy Living, our behavioral health clinic. We have Trinity Inns, which is our sober living quarters, and they have beautiful programs in those living quarters that offer staff recovery coaching. We do life skills in-house. We bridge them into our recovery community, which is beautifully saturated here in Newport County. We have all different types of meetings that we work closely with our beautiful Hope Center, Recovery Hope Center, their beautiful team over there. So we have this nice collaboration where people that reside with us can really continue to build a sober network and access their community meetings. So we also have, I'd like to talk a little bit about, and if you want to ask any questions along the way, but is what I'm really excited to share with your audience for totally prevention and really how to embrace just a place where you come in and you go, oh, I'm in the right place. There's our niche here that really helps people focus on, well, we're all recovering from something. Hands down, we're recovering from something. And so our approach to behavioral health is to look at the whole person, right? It's a person-centered programs that we offer here, treatment. They're all evidence-based, but we really, every person, one family at a time that walks into Trinity Healthy Living here in our behavioral health, which is located in Middletown at 58 East Main Road, right across from the Christmas tree shop. Everybody knows the Christmas tree shop, right across from that beautiful brick building. I welcome your audience to come in at any time and just explore, or if they're struggling or they have family that needs support, to come in and learn about our team, our professional team here, and the resources we have. We do a lot. We have an intense outpatient program that allows, it's a 4-day program that offers folks that are coming from an inpatient level of care or are looking just from where they're at in their recovery or struggling in their disease that want to embrace some kind of form of outpatient services. We have an intense program that is on Monday, Wednesday, and Friday from 9 to 12, and then on Tuesday from 10 to 1. The program itself offers a lot of, didactics as far as relapse prevention education. We do a lot of the work on stress reduction. We look at different ways of life skills, coping life skills. We bring in the universal 12-step community, smart community, smart recovery, 12-step recovery. We do a lot of work with trauma. We also do a lot of anger management that might be involved. People struggle with anger management. We work with the family courts, the drug courts here. So anybody that's got some issues related to those courts, we collaborate with them. We're able to support their needs to help them further along in their recovery, but also their court requirements. We work with a lot of doctors in the community, Newport Hospital, and a lot of attorneys, that are helping people that are dealing with some legal issues. But the other thing too that I'd like to talk about is we also have a different niche of holistic approaches to recovery. So not only are you going to get the clinical didactics of what is needed for you, for the individual or the families for their treatment, but also bring in some really healthy alternatives as far as mindfulness practices. We do Reiki. We have acupuncture, all stress reductions, all leading back into present moment, present day living, how to deal with the symptoms of stress, how to deal with it. Some people, if they're still dealing with post-acute withdrawals, how do you deal with those symptoms in a holistic type of way? Mindfulness is in meditations. We do a lot of exercise in there. People have never been introduced to mindfulness practices. They come in, they're going, oh my God, this works, And so all these things are integrated into this program that, people have really come in and go, I've never experienced anything like this.
Christine,
And people, yeah.
Can I ask you, not to cut you off, I just wanted to, now you talked about community partners, and now you're talking like the stress reduction. After a person goes through like your life skills training, the stress reduction, the holistic approach, how does a person go from that to creating an environment around them to help them keep their sobriety? I mean, do they stay in touch with you? Do you stay in touch with them, or can they continuously come in, or do we connect them with the community partners that you have involved? How does that building the healthy environment come into play?
Yeah, that's a really great question, Greg. And I'm glad you asked that, because that's the bigger part, is once you leave your treatment, right? What happens then? And that I was faced personally myself. And that's what I was talking about, making some decisions, personal decisions on how I'm going to continue this self-care. How am I going to continue to live one day at a time, right? In recovery, dealing with life. I'm going back home into my environment where I'm still dealing with the same stresses. And what we focus on here, and it doesn't end after you might have finished one of the programs, is connection. That is vitally important. The experiencing that sense of belonging and connection. So our folks here, and I call them our team here, is we and our members that come in here for help. We have resources for recovery coaching that continue to work with you when you finish a program here with us. We have individual and group group therapies, individual therapies. We have what we call early recovery groups. So you can stay connected to Trinity and come in and participate in the groups. Our recovery coaches will go out in the community and work with you. We also make sure that it's like case management. We make sure that when you leave here, that you have a plan, and we're going to follow through with you so that you have what you do on a daily routine. It's something we offer in our sober homes, but also any member that comes in here for treatment. It's all about your daily routine. And it's all about staying connected. And how do we help? And so while you're here, you're already starting that peer process, and that peer connection. You're building a network here at Trinity, and then we're helping you bridge it out into the community. And we actually bring in commitments from the community, so it's already started. So as you leave here, you're feeling these connections where you can meet people outside of Trinity Healthy Living, the clinic, and start to build these relationships, right? And learn how to invest that change model you're looking for. Now, you're going to have good days and you're going to have not so good days. We have people that come back and reboot all the time. Christine, I left and that program for 12 weeks, 4 weeks, whatever it was on my counseling, I need to come back and reboot. We get that quite a bit. Even in our sober living environments, it's like, I need to come back for another 60 days or 30 days or 90 days. Because I need to do what I know was working well for me. And that's the support Trinity gives. We continue to stay working with our members. They don't just come in for a short period of time or a set period of time. They're with us. They're like family, and we're going to stay with them. And they know that unless they've choose to, and that's why we work very closely, like with Newport Mental Health and Newport Hospital, because it's if somebody comes to us and we see that they need more support psychiatrically, or they're looking for more mental health support, we're going to call up our partners over there and say, hey, look, we're working with them on this. We need them to bridge them over here and have them focus on this need for level of care. We work very closely together. And same thing with the Hope Centers in recovery. How do I expand my network? How do I expand my, the group opportunities that work for me? But we do have, Greg, a relationship that is established here. And that's what I think you hear when people walk in here and say, I've never experienced anything like this. I feel like I'm right where I belong. And I'm here to continue this relationship with Trinity. And, and it's almost like it's the unknown. Like, everybody knows that's important to have that sense of connection and that sense of belonging, because getting well is so person-centered. We have to meet people where they're at today. You can't bring them to this cookie cut, oh, this is what's going to work, or you should be here instead of here. And there's a mindset out there that kind of believes that. And there's a mindset out there that says, oh, you relapse and it's all gone again. No, it's, let's build on what's been working well, meet you where you're at, and help you move forward. That's what we do here at Trinity. We've had people in here that have struggled, had setbacks, and they come back because they know that what they're getting here, as far as the support and the love, because that's really what we're talking about, right? Is that love and connection, that they can come back to Trinity. And we want to keep it that personal, and for the families. We have families come in here all the time saying, we're grateful that you're helping our family member, but we need help too, and how does this look? Because everybody's affected by this disease. This is nothing new in the community, right? And there's new struggles out there. There's new drugs out there, and they're struggling with maybe a loss of a loved one from an overdose. So, and then, Greg, you and I have talked about grandparents raising grandchildren today.
Right.
That might be another time. I love to talk about that.
Right.
But yes, we work with a lot of grandparents right now, helping them with individually, and then with their family member, their grandchildren and stuff.
Now, do you do family counseling as well?
Yes. And I'd like to talk real quickly. We also do medicated assisted treatment. And that's a path that helps a lot of people where they're struggling with cravings or need some kind of, balance with buprenorphine. We do Suboxone. We do Vivitrol. We offer, we have a medical doctor and nurse practitioner that offers, medication management, or Medicaid assisted treatment. We do anti-abuse, naltrexone, so they can come in. And again, it's that whole person. We got to meet people where they're at. What is going to help you through the next, first 30 days of your treatment? And when at 30 days, you're looking what's going to help you. But the reinforcement every day of that connection with Trinity and what the work that they're doing on themselves is something that we're very much involved in. And we bring family in when they feel it's necessary and ready. We also offer, again, we do the acupuncture and Reiki, which people have really been introduced to and love. And we have a biomat therapy, which is stress reduction as well. So they can get medication management, they can get Medicaid assisted treatment, they can get the intense outpatient program, individual and group counseling, and family counseling.
Do you also have a device called the Bridge? Is it the Bridge?
Yeah. So if you like, so there were, if people are struggling with opioid withdrawals, what I say first is that if you need, if you're struggling and you should be medically assessed and make sure you receive the right appropriate detoxification. If you need a medical detox, then obviously you need a hospital's, some form of inpatient level of care. But if you're or you're struggling with opioid withdrawals that you think on an outpatient level can be assessed and evaluated, we have what we call a percutaneous nerve stimulator. It's called the Bridge device. It's had its clinical studies and is FDA approved, where if people are struggling with, again, post withdrawals from opioids, they can come in on a scale. We have a nurse practitioner that will do an interview and see if that motivation is there, if they're a good candidate for the Bridge device. So they go through a little bit of an assessment, not a little bit, they go through a full assessment, evaluation, and an interview with our nurse practitioner. So if they're still symptomatic, even if they're coming off Suboxone or some other form of Medicaid assistant, and they're symptomatic, or here's what the key is, the fear of withdrawals, this device has worked very well for helping people come to a zero withdrawals within their own personal situation. So let's just say you come in where you got little restless knee syndrome going on, the sweats, a nurse practitioner will make sure that you're a good candidate for you. They will put in, it's a percutaneous nerve stimulator. So it sends nerve impulses to 3 parts of the brain, which basically calms the brain down and allows the individual, while they're wearing this nerve stimulator, to reduce those symptoms. Okay. You can wear if they feel after, oh my gosh, within 45 minutes, they could be symptom free, or they could be a little bit nervous that what if the symptoms come back tomorrow? So you can wear this Bridge device up to 5 days under the supervision of our nurse practitioner. And it's and we've had patients that have come off Suboxone that it's worked really well for. And then on top of that, we bridge them into maybe some other form of like a Vivitrol shot or some kind of naltrexone or something that might help them further along their recovery if needed. But it's all under the supervision of our nurse practitioners that will monitor their medications while again, it's a natural nerve stimulation. It's not really invasive where it interferes with their, any of their current existing treatment or medications that they're on. So it's a safe device.
Wow, that is great. It's new.
It's new, very
I
interesting.
haven't
Yeah,
heard that at all.
I heard Christine talk about it probably maybe 3 years ago. It was an in-person meeting, so that's how I'm trying to date it. But here in our conference room, probably for some prevention meeting, I think you were introducing it as a new option. Yeah.
We have the company that produces the product is still trying to work with insurance companies and get it approved. We've actually introduced it as well to Medicaid and Blue Cross Blue Shield locally here and within our state. And they have their own means in which they look systematically at what considerations would be into covering the cost of the device and the services. But we try to work with each individual that comes in as best we can to make sure that we can provide them what their needs are. So I know that insurance question comes up quite a bit. So
it does.
So does this nurse practitioner and the monitoring, does this go on at all facilities or just the Middletown facility or?
Yeah, it's primarily done at the Middletown facility. So we have a room set up here and the nurse practitioner who's trained in it. And yeah, so it would be offered here only in the Middletown right now. And that's good for observation. Yeah.
Your other facility is Trinity Inn, right? Is that correct?
We also have, Yep. I'll also let you know we do have a Trinity Healthy Living, a behavioral health clinic in Johnston as well.
Oh,
We opened one up about 8 months ago that offers the services. So you can also, if you call through our 800 number, or if you go to the website, or if you call directly into either one of those locations, it's on our website, the campuses that we offer both at Johnston and here in Middletown. And yes, our sober living. We have a wonderful, we're very excited about some new opportunities that we're working towards, looking to expand our sober living quarters in our Trinity Inn here on Aquidneck Island. There's a possibility where we could look at expanding some units of residents, 12 units of residential sober living recovery residents here on the island, along with in the same facility, offer outpatient services. It's something we're working with our community partners, a town of Middletown, and our CDBG group to see if we can fund building a 12-unit recovery residence and outpatient services here to expand the services because of the need and providing access. It's no secret that recovery residences are it's evidence-based that people do thrive and do really well in a sober environment while they're embracing some kind of treatment or just getting back into their daily routine and sobriety. So we're looking at expanding our model. We put a program in there with staffing, and that has really served well our members that have resided. We had a women and children's house in Portsmouth, and again, a men's house in Newport County that we're transitioning right now. We're looking to open up another interim house until this new model that we're very excited about in Middletown that'll be opening up that 12-unit, hopefully, with our outpatients. So yes, if anyone is interested in our sober living quarters that we collaborate with Community Blessings and Ocean State Recovery Housing, we're part of them as well, and the Behavioral Health Department, their 942 Stop Grant. So please feel free to give us a call in, and we'll see what we can do to support your needs around sober living.
Is it hard to get into sober living? We often hear there's a long wait throughout the state, everywhere. So do you have a long wait?
Thanks for asking that, Pauline. And that, if anybody's listening out there from our community, that makes a difference as far as we need to continue to expand sober living quarters. We need recovery residences. We need them funded. And that's what we're hopeful to do in Middletown with this beautiful location and this project that we're working on. Right now, for the most part, working within the recovery residence community, everybody is struggling with and expanding, So yes, there are wait lists. We have a short wait list right now for September, but I always tell people to keep calling in, and I have, I follow up with them, to see how they're doing in their recovery, because we're not just, again, we got a roof over your head, that's sober living. No, we care about the individual. So we'll stay in touch with our members on the wait list and they're welcome to call in. And as soon as we have, it's very, it's like a rolling admission. So there's no set time. For the most part in the program we offer, we have people that stay there from an average of 3 to 6 months. People can stay with us up to 2 years, if that's what it takes. So we want to make sure, and we bridge in the families, that we have an integrated model that even while they're staying with us, we integrate them returning back home. So it's not just you're done with sober living and you go right back into home. We have a transition period, which is our integrated model, where they'll stay at the sober house and we help them with their families integrate back home in their recovery. So I love it so much. It works so well. And it was my personal experience that helped me. So we continue to help people. And that's why there's a need for, more expanding the recovery residences, opening up this model where people have services available to them while they're residing there. And they have the ability to stay as long as they need, and there's a wonderful grants out there that we're working with to get the funding for this through Community Blessings. So hopefully that will all come to fruition within a year, or two. So
one thing that I've really admired about, this interview, this podcast, is you can actually hear and see the love that you have for this project. You can see it. Is that because of your personal story? Is it because you can really identify with pretty much anyone who's walking through that door because you've been through your own struggle. Is that where it derives from?
Absolutely, Greg. And I'm passionate about it. And it's an inspiration that came about 4 years ago that that when you find that you have something that you've personally experienced, that, and this is what peer recovery is all about, that you can help put a hand to help out to somebody else. And there is an unbelievable almost moment of trust that you've lived this experience. You know what I can't describe, you can identify with, and help me help myself in the sense of feeling that I'm not alone anymore and I'm going to be okay. And that's one of the biggest things that has to come deeply within their hearts and connect it with their minds. And that came through my personal experience. But there is a love and a sense of connection and service that has to come with anybody struggling, that they know that they are not alone and that they're going to be okay. So that hopelessness and that despair and that desperation, you're almost the light in that dark room for a moment. And you want to bring that forward. You want to help them give that hope, bring that light forward to them, knowing, you know what, I'm going to love you until you can love yourself again. I know how hard this is. Same thing with the families. The love is there. It's just the nurturing of it and being able to be there and provide the support for them, and showing them that it works. It's a power of example as well. Not only are you dealing with helping them feel connected and a sense of belonging, that they're okay, they're cared for, but that they see the results of this, that this, I too can get well, and I'm not alone in this. And you see on my model, I'm about the mind, body, and spirit, the soul. So we look at this whole person, the well-being of someone. So as soon as they embrace Trinity, they're embracing that whole beautiful circle, if you will, of love, of that we understand what you're struggling with emotionally and mentally. We understand spiritually how the depth of that, how you're broken, the brokenness of that. And, we also know physically what you're going through. So we're going to wrap our arms around them passionately and just let them, you just say yes to, this too can be, recovery is possible for me as well.
I can imagine parents with kids that the peer recovery model and having people with lived experience and people all around you must be so helpful. Having your child with you, or and knowing that you're still in taking care of them, but also having tools to deal with the stresses of being a parent and also your addiction. That I can see that as an amazing tool. With Trinity Inn, when you have young children in there, do you offer services for the moms that deal with the kids as well?
Oh, that's beautiful. Absolutely. We work again with Project Bright. We've worked with Starbirth. We've had children, infants from the ages up to 8. We've worked with Starbirth Women and Infants Hospitals and DCYF. And absolutely, the focus is helping the mom or the parent get well, but also the supports that are needed for behavioral for the children. I'm going to tell you a real quick story, because we have alumni and we keep in touch with very close touch with our families and our members. Is this was a beautiful person that came from Starbirth, and she had struggled a lot of PTSD and trauma, and so much for the child as well. And when I got the beautiful call, they said, Christine, we think this is a good fit. You could put some services around the children, and really having the mom continue the beautiful work that Starbirth does. Just to have that continuum, to bridge them straight into a sober living environment with services in there, and a women and children's home that can help continue the nurturing, right, of the mom's recovery, but also for the child to feel nurtured, safe, secure, love. And we bring them into our homes, and as we put the support services around them, it's amazing. It's mystical to see how the mother gets well. They're nurturing their child, in a healthier place, right? The changes that happen in the children. Now we have playrooms and all of that, and you can see how the children interact with one another. So you actually get to see the moms get well, but you see these children start to interact well more as a family, feeling that sense of family and connection and community at a very young age. So you're seeing intergenerational change. And that's what I'm passionate about. want to we want to help break the cycle of addiction for intergenerational change. And that's whether it's in residing with Trinity or in your own home. We'll come to your home. We'll do those service works that's needed, but it's all about breaking that cycle. And I'll end it with this, because from a personal experience, my daughter was 6 years old, maybe a little less. And I know she wouldn't mind me sharing this, but her junior year in high school, she had to write a self-reflection paper, and I'll give you the short version of it. And really what she wrote about was, and it was in prep for her college, how she was going to prepare for her college essay, was what it was like growing up with a mother who was an alcoholic and addict, okay, who struggled with mental health. And it was a 4-page document that I never knew she wrote. And the year she went to college, she left in a little envelope folder on her desk. Now, there was no label on it, but I'm cleaning her room and she's gone on her way. And I went over there and I opened it up, and I, felt it might have been left for me, right? So I started reading. The first 2 pages were hard. It's hard what we put our kids through, and what we, that like the impact of that trauma on those kids. You don't see it when you're in it, but you realize it as you get well, the needs that they have with the trauma that's been induced under their addiction and alcoholism, right?
Mhm.
And so I saw those first 2 parts of, the fear, how she had to have the over sense of responsibility, taking care of her siblings, that her grandmother was there, wasn't there, father was there, the changes of where she stayed, who she stayed with, how she went to school, what she was able to attend, what she couldn't miss, how she took care of it, making lunches, a lot of things that eye-opening to me. But I was like, oh my God, she went through that. The second 2 pages of her report was about what she learned about herself. Powerful. She learned about resiliency. She learned about how she turned inward for inner strength, because she saw her mother fall down and pick herself up and start living the right way. And those little examples that I never saw, but my own personal recovery and getting well and start living healthy and living the right way, had that ripple effect on her at a very young age. And the years of that, because now she's going to college. So that intergenerational change had started, because not only could she self-reflect on, start making healthy choices, start, making healthy decisions for herself, but she found and recognized in herself her own inner strengths, her positive attributes, what she learned and what she was able to get through, the resiliency in her, and how it helped support her thriving in her own personal life. And so that's the message I want to say to your audience, is that, we just, like, unfortunately, destructively, our disease has a ripple effect on our family and our children, but so can our recovery. Our recovery can have that beautiful reflection on living the right way, healthy, taking self-care, building a beautiful network and sense of community, a sense of belonging and family. You can restore families. Families come back. Children are now learning, next generation, that she has grown up with a mother that's in recovery, a person of recovery from alcoholism, addiction, and mental health. And she too can bridge that into her own family. And when she continues to, and her own circle of friends. I mean, there's things that, my son that's going to college chose a sober living dormitory, and I did not know that was a choice for him. Now, I'm not saying, look at my kids. I'm saying that indirectly, and even quietly and mystically, you never know how your recovery can affect not just your family, but even one person that's struggling in the community. And that's why peer and life experience and really has a ripple effect. So I hope your audience enjoyed some of my little personal stories there, and I know my children wouldn't mind sharing that. But that doesn't mean that they haven't had their own personal struggles, but they have a mother that's in recovery that has probably been able to identify with some of those struggles and help in their own recovery, guide them in a better direction. So, and for that, I'm responsible for, right? I'm responsible for that. So, all right. Any other questions? I just love it on here. I love totally preventable. On our website, I'm going to promote you in our groups. Do a live cast if you want here.
Well, that's great. That's great. I do have a question for listeners who maybe this is their first time being introduced to Trinity, and to community partners who may be interested. How would they get in contact with you?
Sure. So there's a couple of ways. For any community partner, I invite them to call us directly at 401-662-5390. That's a direct line, not business line for myself or any of our professional teams, my partner and all. Also, you could call our clinic, which is 401-608-3322. We also have an 800 number that might help members in the community if they can't get a hold of it. That's 24/7. So you will get somebody that will pick up. That's 1-888-344-4045. All this information is available on our website at www.trinityvillage.org. If you look and contact us, it's got all our numbers for our campus, both for Middletown and Johnston. And we'd welcome any calls, inquiries, or just come in and visit with us. Look at our facility and meet our team here. We'd love it. So anytime. We offer both our community partners to come in, and we're trying to build our community partners. We work with our Substance Use Mental Health Leadership Council, which is a huge bridge for us to be able to continue to collaborate our efforts. Because again, you might come to Trinity Healthy Living, struggle with certain struggles, and after our assessment and working with our team saying, we need to put you through this, you would be better served or collaboratively served with maybe Newport Mental Health, or look at partial hospitalization programs. And I know we have a beautiful commission coming up called the No Wrong Door coming up. That's going to be open. So I'm advocating for it right now on your show. Yeah,
I see some smiles coming from the other corner of the room.
Absolutely. No Wrong Door commission. I can't wait for it to launch. It's going to be wonderful. And we're blessed to be a part of that. Absolutely blessed. A lot of work, a lot of dedication into this new No Wrong Door commission. So I'm excited.
That's awesome.
Yeah.
Thank you so much for sharing your story with us and telling us all about Trinity Village and Trinity Inn and all of the services and everything you have for our community. It's wonderful. We appreciate it.
Really, really do. Thank you so much for sharing your story.
I'm deeply grateful. Thank you so much, and have a beautiful day. And thank you to your audience as well for tuning in. I appreciate it. Give us a call.
All right. Thanks.
Bye now.
Bye-bye.